My name is Yvonne Coghill and I'm the Senior Programme Lead for Inclusion in Coaching at the NHS Leadership Academy, and today I'm going to be talking about the importance of inclusion within the NHS. I think that inclusion in the NHS is important for lots of reasons, but not least because our society is becoming much more diverse. There is many more diverse people within our societies. And obviously the NHS, an organisation with 1.4 million people and employing lots of people from diverse backgrounds, we need to be fully inclusive. We have a responsibility to our populations, so we need to be able to have people within our workforce that understand difference, that can work with difference, that actually know what to do for all sections of our populations. We have a constitution that talks about inclusivity for all. The first principle of our constitution talks very clearly about making sure that all our services are in place and perfect for people from LGBT backgrounds, people who are disabled, older people, and so on. And so we have a responsibility to make sure that we have a fully inclusive workforce that understands the importance of inclusivity inside and outside of the NHS. The other issue is that it's a health issue. Having an inclusive workforce means that people are going to have better health outcomes. So what do I mean by that? We know that if people are well cared for, they care better for other people. So if we have a workforce that feels included in everything that's going on in the NHS, that feels that they are important to the NHS workforce, so people are getting equal opportunities to do development, training and development, equal opportunities for progression up the ladder, equal opportunities in terms of getting jobs, for example. We know that that will make people feel more motivated, more included, more part of the family that is the NHS. And as a consequence of that, those people will give 100%, 110% more of themselves to the service and feel an integral part of the service and able to give back to our patients and to the people that we're working with. So it's a really important thing to remember that inclusivity ultimately leads to higher quality patient care. We need to set an example, basically. And we can actually do that really well by showing the rest of society how inclusive we are, so that when people come and use our services, they feel that the services are for them, that we have actually considered and thought about their needs. Whether they're from a black background, an Asian background, they have physical disabilities, they have mental health issues, they're older people. Whatever your background, we need to make people feel that the NHS is for you. So we need to have a workforce that understands that, and we have to have a workforce that totally understands what it means to be different. And that means everybody thinking about and wanting to ensure that they give the right service to everybody who comes in through the door. So what does that look like, and what do we mean by that? We mean that all members of staff are thinking all the time about giving the people that are coming in through the door the service that they deserve and need. And that will be different for everybody. And I think that trying to get people to understand that is absolutely key. And for people to understand that, we need leaders that understand that. And here at the Leadership Academy, it's one of our central tenets. It's one of the things that we absolutely believe in. So across the whole of our programmes, our core programmes, our top leaders programmes, we talk about inclusivity a lot, and we don't apologise for that. It's really important that people understand that the communities that we're serving are diverse, and that we have to, and there's nowhere to go with this, we have to ensure that people understand that inclusivity is important, and we have to deal with that. Getting our senior leaders on board and getting people, particularly people from white backgrounds, to understand the importance of inclusivity is really important. And I think if you talk to people, they will say, yes, we get it, and we know that this is important, and they do know that at a cerebral level. We need to get people to understand and get it from a values-based level, from a behavioural level, from their gut. And that's the tricky and difficult bit, because If you've grown up in a society that doesn't necessarily mean that you see difference or difference is important to you, you don't necessarily understand the impact of being different in society. And I think that's really important. So what we try to do is to get our senior leaders to empathise with people that are different. And that can be quite tricky, because you're trying to get people to stop and think about where they've come from and their experiences, and trying to get them to understand other people's experiences are different. And as a consequence of them having different experiences, they might be coming from a different place. So you would need to perhaps consider those needs as being very different to your own. And I think that can be a really, really hard thing to do, to shift people's thinking. And I know that for myself. So for example, when I see people who are from homeless backgrounds, I might empathise with them immediately and put £1 in their bucket, and I walk past and I forget. I forget where they've come from, I forget what's happened for them to be in that place. So what we're asking for is for people to remember all the time that we're dealing with difference all the time. And so it's a really tricky and difficult thing to do. And so we need our senior leaders to be able to remember that all the time and to work with difference all the time. All of our programs, our coaches, our faculty are being immersed in the importance of inclusion. And thankfully they're beginning to understand that everything that they do and the way they talk to our top leaders and other members, people who are on our programs, is around making sure that it's better for patients. And inclusivity is one of the things that we really, really need to put central to absolutely everything that people do and say. The race equality standard is something that is quite new within the NHS. And I've been working in the NHS for quite a long time, and we've never had what we call a race equality standard. The Equality and Diversity Council recently decided that it was important for us to have a race equality standard. What we're asking people to do is to remember that race is important, that difference is important, that people's experiences are different. And so we're asking the NHS to think about very, very carefully how it treats all members of its workforce, and to ensure that they have a clear idea of the numbers of people that are different within their workforce, and that they actually consider how those people are treated within the workforce. We had a report called Snowy White Peaks, which was released probably about 3 or 4 months ago, which highlighted the fact that very few black and ethnic minority staff in London are at the most senior levels. In a place like London, where you have nearly 50% of the population from black and minority ethnic backgrounds, you would expect to at least have one chief executive from a black and minority ethnic background, and in fact there are none. And there are less than 8% of the actual senior leadership workforce from black and ethnic minority backgrounds. So something needs to be done, and something needs to be done differently. And so the race equality standard is something that we're thinking about having across the whole of the NHS, so that people are able to consider the needs of people from different ethnic groups within the workforce. So using things that we already have in place. So for example, people would be able to look at the data that they collect, because statutorily we're supposed to collect data anyway on ethnic groups and other groups. So we're supposed to collect that anyway, so they should have that data. So it's not as if we're asking them to do more. We're also asking them to look at their staff satisfaction surveys, something that's done on a yearly basis. Are your staff happy? Are they okay with what they're doing? So staff are asked to answer questions, and there are several questions within the staff satisfaction survey which allude to ethnicity. So questions like, are you happy at work? How do you feel about working where you work? How do you feel about your training and development opportunities? How do you feel about bullying and harassment in your organisation? And what we found is that there are different responses for white people and for black people in the NHS. There's a gap. What we usually do is just average it out. So what we are asking people to do is to look at the gap. Is it a big gap? And we're not asking them to do anything other than to try to close the gap. So you recognise what the issues are, you recognise the gap, and you start working on closing the gap. So on some of the issues, you might find that staff, black and white, feel quite content and happy in terms of the training and development they get. But there might be an issue around bullying and harassment. So that's something for you to focus on. So year one, you might find that there is a 15% gap. You might want to work towards making it a 10% gap. So it's not expecting and asking people to be perfect. It's asking people to be mindful and to think about how they make things better for staff. And we've already said that staff who are feeling included and part of deliver better and higher quality patient care. So it's a wonderful thing, I think, and I think it will work incredibly well. As long as people recognise it's not a tool to beat people up with, it's a tool to help support high quality patient care and engage staff in the NHS.